Okay, in about 5.
This can be good.
Yeah, a little bit. It's taking a little bit. Okay, you're live. So go.
Aloha,
Good morning.
and thank you for joining us today. My name is Eliza Lip. I am the director for the Maui Behavior Analysis Office with Beata Home Care. Hawaii is the 42nd state to pass autism insurance reform. Today, we are here to discuss applied behavior analysis, also known as ABA services, and how families can receive services for children with a primary diagnosis of autism spectrum disorder, ASD. Please note we are not here today to diagnose or provide specific medical treatment.
Good morning. My name is Dr. Lori Babbitt, and I wanted to give you a little background on myself. I have taught special education for about 10 years early in my career and enjoyed my time in the classroom and became interested in diagnostics. So I went back to school, got my master's degree in special education and diagnostics, and I worked for 11 years on the specialized assessment team doing early childhood assessments for the school district. Then I went back to school again and got my behavior analyst certification, and I was the behavior analyst for a medium-sized school district for about 10 years before I moved to Maui just over a year ago and earned my doctorate degree at the same time, but I'm very happy to be on Maui.
Hi everyone, I am Shana. I am currently the recruiter for the Maui Habilitation Office, but prior to transitioning into my current role, I worked as a registered behavior technician under the supervision of Dr. Lori Babbitt. I definitely gained an interest in behavioral health and healthcare at a young age. I was involved in a program that allowed me to, to volunteer with individuals with intellectual and developmental disabilities, and from then on, I went to study health sciences and minored in psychology, and I went to also pursue my master's in public administration. I have been with the Beata Ohana since 2014 and have really enjoyed my experience. Just being part of a team that is committed to serve our clients, and it's just been an awesome experience here. So today we hope to provide you with some insightful information about autism, and we feel that one of the main or first questions that you may have is, what is autism, or what is applied behavior analysis? So what applied behavior analysis is it is a scientifically validated approach to understand behavior and how it is impacted by or affected by the environment. ABA uses various techniques and strategies to bring about meaningful changes and behaviors, and some of the primary focuses of the ABA include, but are not limited to, communication, participation in daily activities, eye contact, play skills, and social engagement.
Okay. April is Autism Awareness Month, and we're happy to bring this to you during Autism Awareness Month to wrap that up. And one question that came up, what is autism? And the definition of autism, according to the Mayo Clinic, is that autism spectrum disorder is a serious neurodevelopmental disorder that impairs a child's ability to communicate and interact with others. It also includes restricted or repetitive behaviors, as well as restricted interests and activities at times. These issues can cause significant impairment in social, occupational, and other areas of life functioning. There's not one autism, but there are many types of autism, and they're caused by a different combination of genetic and environmental influences. While there is no cure, there is definitely treatment that can help with the symptoms, the developmental delays, and the communication, and helping to boost skills that are missing. And we have a center here. This is our Lego wall that we're very proud of and the kids enjoy. But at our center, we are centrally located in Kahului, Maui. And we enjoyed a grand opening in February. We had many community members come out, parents and families, and enjoy a traditional Hawaiian blessing of the environment, and really enjoyed opening up to the public to let them see that the center is available. Parents, when we look at services, parents can come in, sign in, and drop their child off for services, and you're able to leave and come back and pick up when your child's services have ended, or you can stay with us at times. And also, we are open Monday through Saturday. We provide one-on-one services with your child. Registered behavior technicians such as Shana will be working with your child, and a behavior analyst supervisor. And Shana and I have enjoyed working together for a while now. We also have social groups. So we're starting up with social groups being held here at the center. And we can have groups from anywhere from 2 to 8 children at one time and work on those good social skills and playing together and conversations and things like that. Okay?
Okay. And although ABA services are also provided in the home, the auto also offers services here at our center as well, which is really awesome because, sometimes when services are provided in a home, parents may feel overwhelmed, or it just, there may be a lot of different components involved. So having center-based services gives them the opportunity to be in an environment that is private, that is supportive and engaging, and they are presented with opportunities to interact with their peers.
Mm-hmm. And there came about a question: what can families with a child with autism replicate at home? What can they take away from the center? And we provide services that we want you to use the techniques that we provide here at the center. And that can be communication, how to evoke communication from your child, and also socialization within the family, eating, feeding difficulties, and things like that. So we welcome that, and we have a parent training segment that goes along with services. So we want to spend some time with your family as well and provide training, about what we're doing in the community and in the center and in the home services.
Okay. And one of the most rewarding parts about being an RBT or being in this field of work is it's just not your ordinary job. I mean, for sure, you are presented with the opportunity to make a significant difference in the life of a child that may have autism, and you are presented with the opportunity to be part of their progress and see them work towards attaining their program goals. And one of the rewarding parts about being an RBT, or in my experience, is seeing a child say their very first word for the first time, being able to demand a request for an item, or just being able to finally communicate their wants and their needs.
So Shana, we have a question that came up of how would we go through the training, or what training is needed? How could we apply to work with children with the diagnosis of autism?
Sure. To qualify for this position, we ask that you be the age of 18 years or older. We also ask that you complete a 40-hour training that is completed online, and we will support you, or a BEATA office that is near you will support you in getting the resources. After completing the online component, you will be observed by a board-certified behavior analyst such as Lori or one of the other BCBAs that we have here at our office, and they will kind of see how you're able to implement what you've learned through a competency assessment. And once that is all cleared, you will be eligible to take a exam at the Pearson Center or a testing center or site near you. And once that you pass that exam, you are able to become a credentialed registered behavior technician.
And we love our registered behavior technicians. We welcome you to apply and go through the process. And as we are expanding our services, we definitely want to hear from you if you're interested in this type of work. It's very rewarding, as Shana was talking about. It's to see that progress, and even if progress is in small increments, we love seeing the progress, and it really makes our day to see those pieces of development come into solidify within the child's development.
And BEATA provides applied behavior analysis services on not only Maui, but on the Big Island and Oahu as well. So if you are joining us today and you are on Maui, great. If you are on the Big Island or on Oahu, please check out the local BEATA home care offices on your islands as well. They do provide the registered behavior technician training there, and they have licensed behavior analysts and RBTs, registered behavior technicians, that are also very fabulous. We have another question that came up of how do families access services? So like we said earlier, Hawaii is the 42nd state to pass the Autism Insurance Reform Act, which that means that autism services or applied behavior analysis services for children diagnosed with autism are now covered under the medical umbrella. So private commercial health insurance as well as Medicaid now covers home and community services for children. So if you are a family that has a son or a daughter, or you have a family member or friends that have a diagnosis, please refer them to their pediatrician, to their specialist. They can also contact the local Beata offices and we can walk families through the process. And we can work with yourself and the families to connect with the different health insurance companies and work with you to collect the necessary paperwork. The great thing is that the services are now covered through the insurance companies. So if you are a family with Medicaid, then there's zero cost to services. If you are a family that has private insurance, there is a copay, similar to if you were to go to your doctor's office or a different specialty. So there would be a copay for each visit. And again, if you have Medicaid, then the services would be 100% covered by your Medicaid health plan.
We do have a question coming in asking what is the age range of children that we serve?
So we currently provide services on Maui for children from 2 years old to about 13. We are able to provide services up till the age of 21, and the health plans, again, will cover the services up until that age. Shanna, we have a question of how do we find out more information from services?
Sure, if you want more information on services, you can definitely, if you are on Maui, you can definitely give us a call at 808-244-6879. Or if you are on another neighbor island, you can definitely call one of the other Beata offices near you.
Lori, we have a question for you.
Okay.
I'm a mom. How do I know if my child could use your services?
Well, although we do not provide diagnostic services, that would be done with your family doctor. And we typically receive children who already have an existing diagnosis of autism. And with that, we conduct assessments. We do a developmental assessment as well as frequently a functional behavior assessment to determine our treatment plan and how best to help your child. And even though we have techniques that are systematic that we often use, your child's program will be tailored individually to your child. So although, like we talked about before, when we talk about the symptoms of autism, it is a spectrum disorder. So every child is a little bit different, and it's really important that we get that individualized assessment so that we know, what are the building blocks that might be a deficit for your child, and how can we help build those skills so that your child has solid skills. We also do behavior assessments if your child's having some behavior issues, and that can range from, anywhere from adaptive behavior, which is how your child functions at home and around the house and through life, the daily living skills type of assessment, as well as looking at communication, again, language, socialization, and independence. We can help your child work on becoming more independent throughout his or her day. So with a diagnosis of autism, get in touch with your insurance company, and they can notify the office, let the office know, and they'll speak with Eliza and get the ball rolling.
And I do want to add, applied behavior analysis, although it is not specific to autism, ABA can be used for many other reasons. Right now in the state of Hawaii, the applied behavior analysis is covered through the health plans specific for autism. So you will hear the two go hand in hand, ABA and autism, and that's really because that's what the health plans are covering, although ABA does help with many other things. a diagnosis is required for the health plans to authorize and cover the services for children. There, again, we will work with you and get you in touch with specialists if you believe that your children may have autism and you do not have a diagnosis. Like Dr. Babbitt shared, there is a spectrum, so not every two children are the same. And so if you have a family member that has a diagnosis and you think, well, there's no way this child can because they're so different, you know, it really is very unique to each child.
And really, to build on what you're saying, you know, some children with autism present with severe social and communication deficits and have those markers in place. And then some children present with marginal impairment of either category. And that can include, you know, what we look at when we provide treatment for your child. We want to improve communication. We want to help with that decreased interest in social situations by providing those good social skills and the building the foundation of what's needed for social skills. And also address the restricted activities facet of the disability as well. So our outcomes are really optimized by a structured behavior intervention and by addressing core and associated deficits of autism.
We have another question. Where do you see services going in the next 5 to 10 years? And will services be growing? So great question. I think because the services, again, ABA is not new, diagnosis of autism is not new, but the insurance companies covering services is relatively new, and I do foresee our service lines growing. We started out with 1 behavior analyst on Maui, about 17 on Oahu. We now on Maui are about to onboard our 4th full-time behavior analyst and are hoping to bring on our 5th full-time behavior analyst in October. And we have a center on Maui, and we are hoping to open up centers on the Big Island and Oahu as well. And so we definitely, in the next 5 to 10 years, see the service lines growing. We're hoping that on the island of Kauai, our Bay Ata office will also provide ABA services. And we look forward to working with the different health plans and the families and really giving the services and providing the services that are medically necessary.
We have one question coming in. How can I help my son with sensory difficulties? And that can be a broad question. Sensory difficulties can run a gamut from, you know, overload of environmental overload, sensitive to light, sensitive to sound. But that's part of the individualized assessment and treatment process. So your son would be evaluated, and the symptoms that come out during that evaluation would translate into a solid treatment plan. Typical sensory session equipment. We do have a sensory room. Very good. We have a sensory room in our center, and our children take breaks in there. They enjoy socialization in there. We have a trampoline and tubes to crawl through and a ball pit and things to play with like that. So they enjoy going into the sensory room, especially when they've worked so hard on their developmental skills and programs. So that's a big part of it as well. And the socialization that happens in the sensory room is really natural. And we're in there with them. It's not a drop-off type of thing. So we typically have them do program work, and then when we take a break, we go into the sensory room. But I have enjoyed seeing the natural socialization that goes on in there. We can facilitate a little bit, but we do like for our kids to go in and have a good time and take a break as well. But they've talked to one another. They recognize each other and call each other friends. And that might be for a child who has very limited language. So that's very exciting as well.
And for those of you who are just joining us today, you may be wondering, what is applied behavior analysis, or ABA? ABA is a scientifically validated approach to understand behavior and how it is affected by the environment. ABA uses various strategies and principles, and some of the primary focuses of ABA include communication, participation in daily activities, social engagement, social interactions, and so forth.
And ABA has the greatest amount of research support for disorders of development and delays. And in learning, these are treatable. It's not a static situation where deficits in development remain the same. Although there is no cure, we can certainly, again, help you plug in those needed skills to further your child's development.
And I think that's a great point, Lori. So one of the big components of ABA services that Bayada provides is caregiver or parent training, and the programs that the BCBA's Dr. Lori Babbitt would be running with your son or daughter, and that the registered behavior technicians are trained to implement, are also reviewed with the parents and caregivers. And so we want to make sure that there is the consistency within the services and the goals that are being worked on.
Mm-hmm. Okay. We have a question coming in about what types of things that we do at the center. What kind of programming can your child access? So when we start treatment, we have a treatment plan in place. We've already gone through the assessment piece and have developed an individualized treatment plan for your child. And those first few days where your child comes in, we are doing what's called pairing with your child. And when we pair, we're really developing that solid, fun relationship that sends a message to your child that reinforcement is available through whomever your child is working with. But then we're also programming for your child's individual needs. So again, communication, language, adaptive behavior, or daily living type of skills. That includes toileting and some of the difficulties that are typically there for young children, looking at socialization as well as independence. And the parent training piece is actually one of my favorite parts of my job. I have many favorite parts, but I really enjoy parent training because it gives you the tools that you need to, again, replicate services and really develop a new relationship with your child in a way that you can communicate more easily and enjoy one another.
We have a question. I'm headed to college and thinking about getting into the ABA field. What types of jobs could I have, and does Bayada provide training? So I will speak a little bit to that, and then Lori, maybe you can, Dr. Babbitt, you can expand. So there are many job opportunities, and Shayna, our recruiting manager, is kind of our point person. So the registered behavior technician, which is our one-on-one direct support worker implementing the program. We also do provide supervision for individuals who are interested in going to school and obtaining their BCABA or their BCBA. And we provide individual supervision, and we also now have group supervision programs. And like we said earlier, we have services on Maui, Big Island, and Oahu. So the group supervision component allows all of our BCBA candidates or BCABA candidates to join in on group supervision throughout the islands in the state of Hawaii. And I'll let Dr. Babbitt speak to that, as she is currently providing supervision for a few of our BCBA candidates on Maui.
Mm-hmm. Our BCBAs that work here at Bayada, almost all of us supervise candidates that also work internally at Bayada. And as they're going through the process to become a BCABA, they are many times also working concurrently on their master's degree. So it's a rigorous process, and we're here to help you through that every step of the way. And supervision, we provide oversight for you and really help you through things that you might be struggling with in your coursework and also in your applied work as well. BCABA, now that's an board certified assistant behavior analyst. That requires a bachelor's degree and then some additional coursework, and we can provide supervision for you as well, which is a a big, it's a big help to have that internally coming from the people that you work with. That's a huge advantage to doing that, and we enjoy helping one another in that way.
Thank you so much, everybody, for joining us today. We really enjoyed sharing our experiences and our service line with you. There are many other questions that came in, and if you would love to answer them at a later time, please feel free to contact us. Our local number is 808-244-6879, which is our number for Maui.
Okay, we've enjoyed being with you today, and we love what we do. Thank you for joining us.
Aloha.
Aloha.